Welcome to the TCC Paramedic Preceptor Program. My name is Diane Petway, one of the full-time faculty members in the EMS division and responsible for the field internship program. I will be covering some of the highlights in the program in this presentation, which is a supplement to the clinical field handbook that you currently have. First, I'd like to thank you for being a preceptor for our students. We certainly could not do it without. The first section I'd like to highlight is going to be your responsibilities as a preceptor training our students. Keep in mind that each student comes to the program with different level of skills and knowledge that they have acquired in a previous job or previous healthcare profession, or they could actually be new to the healthcare profession altogether. So when you're training these students, that is something to keep in mind. What level are they actually at? Are they brand new and have not been exposed to medical patients before, or have they been working with them for a while? That can be good and bad. So you have to evaluate the student to make sure they're not trying to bring in some bad habits that they currently may have that they're practicing in the field. That would be a time to try to change that habit that you actually observe that needs to be changed. During the evaluation process, this is very important for the student and how they move forward. They need to know right off the bat if they really are doing something wrong, or is there a better way to do things than what they're currently doing. You know, there's many ways to perform the same possibly skill. Some are better than others. So we want you to pass on those little tips that you may have for them, as long as they're good ones now. If you have any problem with the student, we want you to notify us immediately. If there's a problem that you may see consistently with students, maybe it's not the student, maybe it's how something is being presented to them. We would like to take care of that, as I said before, immediately. Or if it is a student that you've seen that you seem to think that there's an issue with their performance, please notify us. Even if it's minor problems, we still want to be aware. You always can call the clinical coordinator and contact us immediately and talk to us about this situation, and maybe we can go ahead and take care of it immediately, or talk to the student later on to prevent that same occurrence. Some other general guidelines that I'd like to highlight is going to be your dress. The dress code is in the clinical field handbook underneath, naturally, clinical field dress code. You always have the right as a preceptor to send these students home immediately if they are not dressed appropriately. Also, during their first shift with you, we'd like you to give them some type of orientation to the unit and or agency as far as some emergency things, if it's in the hospital, where the exits are, the fire extinguishers, what to do for a different type of level of threats that may actually be in the hospital, and then the agencies, any type of emergency code situations you have, if you can let them know what to do. Now, we're not asking you to train them as you would an employee, but certainly we want them to be aware of emergency situations that they can participate in, and for them to be safe and for the patients to be safe too. During their field ride time, in order to be in the student role, they always need to be the third person at all times. So you could have the driver and then one in the back and then the student. If they are self-scheduling, which means that they actually work for your agency and the agency sponsoring them during their ride time, they still have to be third on the ambulance. At the end of each shift, there actually will be on the documentation that you'll turn in a critique of their performance. It's not in great detail. It's mostly a checkoff sheet, whether they were satisfactory, unsatisfactory, or they need some guidance. And there's also a little area that you can put some comments if you choose to. These comments are very important to our students for them to move forward. We certainly don't want them to get through the entire program and student come to us and say, well, no one's ever told me that before. Some teaching suggestions that are there. Remember that you were here one time yourself, that you were beginning your first day, your first shift, whether it's the ambulance or the hospital. Think about anyone that you had in the past that was training you, and at that time you would have said, oh my gosh, I would never do that if I was training somebody. Remember those words or those thoughts so you do not repeat the same thing. How much information the student gets could vary. Sometimes you have an experienced student that wants more information about what's going on with the patient and can accept all those details that you give them. Or you could have the new student who cannot absorb all the information that you want to give them. So this plays a role in your part as far as knowing how much information do you think this student really can tolerate. Students' progress. Let them know how they're doing. Not just negatives, but positive comments too. Again, think about yourself, that positive comments go a long way versus a negative comment. Reinforcement is very important. Reinforcement, what they learned in the classroom versus what they are actually doing out in the clinical area. We do ask that you not teach protocols though, because that does confuse the students when they're in the classroom in other clinical environments. You certainly can point out there's certain areas that are protocols for your agency or hospital versus what is taught in the classroom. That way they are aware that that's not the norm. How to evaluate your students? First thing, be patient. Okay? Patience is waiting to see how they do. Try not to rush them. Take your time to be familiar with our student. Again, they have different levels of knowledge out there. Some are more timid than others, and hopefully that goes away, which it should, to stay in this type of profession. Constructive criticism. Again, giving that positive feedback to them, but at the same time trying to get them to do something a little bit different. So communication is very important with our students out there, between you, the preceptor, and the student. And please do not wait to the end of the shift to tell them that they're doing something wrong. The dress code, again, they need to make sure they have a polo shirt that they come to work with, not a bunch of graffiti t-shirts or sweatshirts. Now I know wintertime's a little different. They certainly can wear a long sleeve shirt underneath their t-shirt, and they can wear a jacket too. Again, you have the right to send them home. We do have colors that they can wear with pants. Blue, black, or khaki is allowed. They always must have their ID badge on. Their uniform should be clean and neat and not unkept. If they look like this, they should go home. Send them home, okay? And you can notify the coordinator that you sent them home. You can email them, you can let your training officer know, and they can notify us. It's kind of up to what your agency or hospital prefers, whether you go through your supervisor or you go directly to the clinical coordinator. Academic counseling. We have ethical standards, and conduct must always be observed in the field and clinical environment. Okay? No student should be impolite in expressing those feelings or opinions while they're with you or the patients. You can refer to the handbook for further details about the academic counseling process. We do not tolerate any type of academic misconduct. We will take care of the problem. Now, a lot of times you may see a problem, report it, and then you think nothing happens with it. We do take care of it on our end, and we do share that, yes, we did speak to the student, but we can't get into details exactly what happened between our conversations with the students, because that is confidential information. We do have some goals and objectives for our program. You can refer to this on page 14 of the current handbook that we have. The page numbers will change as our handbooks are updated, but it's still going to be under the same heading. So objective 1, this is to prepare students as a competent entry-level EMT paramedic. So basically this is what provides education to the student to get them to basically be the entry-level paramedic. Objective 2, or the students will actually demonstrate the ability to comprehend, apply, analyze, and evaluate information at their level of training. This is considered a cognitive domain. Objective 3 and 4 are present here. Objective 3 is a psychomotor domain, which they will actually demonstrate technical proficiency. You have objective 4, which is the affective domain. This basically is how they demonstrate their personal behaviors in a professional manner. It's also effectively organizing all the information that they get so they can treat the patient in a more efficient manner. Now, during this patient care, your primary survey here, they are in the role in the back of the ambulance as a team member. And we have team leads, which I'm going to go over in a few minutes. But in the ambulance, in the very beginning of the program until the last few months of the program, they're always in the team member, which means they're part of your team, starting IVs, taking care of the patient. They're not leading the call. Like I said, I'm going to get back to that in a few minutes. So now the student is out there taking care of the patients. They have to document what type of patients they are taking care of so they can get credit with their competencies, other known as skills, to work towards testing that paramedic level. When they are doing their documentation, they need to use blue or black ink. Make sure on the documentation that they putting the time, that didn't sound right, did it? Put in, say it slower, the time that they actually arrived and the time they left. And this has to be initialed by the preceptor. So if they get caught up in traffic and the shift starts at 7 a.m. and they did not get there at 8, it shouldn't be 7 to 3 on that shift. It'll be 8 and then the time they left, which would be 3 if that is the shift that they worked, or a 12-hour shift. There's also a place where preceptor initials must be in order for them to get their credit for the skills team member and then later on team lead. Everything they do, it is initialed by the preceptor saying that this is what they did perform so they can get credit. On the back of the note, you'll actually see a section. It's called Behavioral Evaluation. This is a form the preceptor actually evaluates that student. There's 12 areas that are listed, and that's when you will click satisfactory or unsatisfactory, need guidance. On the back of the form, there's a section where the preceptor actually prints their name and signs. Now, your name, please be legible. I know when you write your name, other known as cursive writing, we may not be able to recognize it, but if you have the name that is printed, that way we can actually see it, because the student has to put the name of their preceptor in the electronic format of the note when they leave your shift. And if they can't read it, they're going to have no idea what the name is. Your credentials are in the back. Also circle whether you're a paramedic, an RN, a respiratory therapist, a doctor, a nurse practitioner. So whatever you are, that's what you circle. Now keep in mind that out on the field, our students are trained with paramedics. Now if the student is testing at a different level, then you need to make sure the coordinator gets with the student to tell them what level provider can be with them on the field situation. In the hospital, it's always an RN or higher or equal to. Cannot be a paramedic that's in the ER. They have to be an RN. So let's go over team lead, team member. So what is a team lead? The definition currently is on page 90. This is someone who leads the call. Now remember, being a team lead doesn't mean that the student has to be doing all the skills too. They may not do any skills at all. They may just manage the lead. So now if they're doing the team lead, this is in the capstone part. The capstone internship is part of field only. It's after they finish all their didactic classes, which means all your lecture classes, and they also have finished all their clinical hours and have finished all their skills and or competencies, classroom and on clinical and field. They have to successfully have 20 team lead calls, and they have to successfully have 18 out of those 20. So again, they have 20 calls. They have to be a team lead, but they have to be successful 18 out of those 20. Now, successful does not mean they have to be 100% with everything. Now remember, you are looking at an entry-level provider here. So it's not someone who's seasoned out there and can run any call there is out there. Occupational health and safety. This is the same as you do for your employment where you are. So we hope that you will help students maintain their occupational health and safety, the same you would do for your peers that you work with. Do not put them in a dangerous situation, or do not put them in a situation that you think that they cannot handle yet. And sometimes they may never be able to handle it depending on the situation until they are very seasoned providers out there. So again, we're asking that you work with them the same as you would with your peer on their safety measures, and make sure that they are following their infection control, other standard precaution, universal precautions, whatever is needed. Help them, guide them through this. Body mechanics, same type of thing. Understanding their psychological hazards of providing pre-hospital care. There can be a lot of stress involved. Sometimes we get patients out in the field or in the hospital. Pediatrics is really a stressful call as far as if you get a code situation and a death of a child. So we ask that you work with the student through this, and also if there seems to be a lot of problems with this student during your shift not being able to handle what they dealt with, they may have to just go home. But if they do, we ask that you please call us so we can follow up on this. Physical condition, same thing as you as an employee, being able to move patients around. What is the best way to move them? What type of equipment do you have? Trying to protect the student's body as you would protect yourself from injury. So these are some areas that they are actually taught in the classroom situation and also in the lab. If you feel at any time these students are actually performing skills in an unsafe manner consistently, or saying they don't care about it, this is how they do things, please let us know so we can be aware of this. Once again, I want to thank every one of you for being a preceptor for TCC Paramedic Program. This concludes our video that is a supplement to the handbook. After this video, you are to please take a 10-question quiz. Make sure prior to the video you filled out the information, because once you complete this on the field, it will be submitted for 1 CEU for your education for your paramedic recert. So again, please make sure you complete all the information that is requested of you to get the CEU, and we keep this on record for a preceptor list that we can show accreditation or anyone else that comes in to ask if our preceptors have been trained or not. Again, I'd like to thank you.